This video is to help those living with dementia. That includes the person with the diagnosis. More importantly, the person that cares for them. In an ideal world, we'd want both of you to attend when we discuss your treatment options, because they will have changed since you've been diagnosed, as it's going to be more difficult for you to maintain a healthy mouth. As your capacity is likely to decline, we need to take a little bit more radical approach on what treatment options are available while you're still able to have the treatment. Ideally, we want to maintain regular appointments with your regular dentist and hygienist, because that helps with your cooperation. The medication that you're on often works against us because you end up with a dry mouth, leaving you more prone to oral disease. We all need to keep our fluid levels up and keep our mouth moist, but we don't get moist with sugar-laden drinks, and this video in the app explains why. As a carer, you may want to help maintain regular habits and get your person with dementia to copy you rather than you do it for them. Power brushes have been shown to be more effective than manual brushes, so we strongly advise these, and this is a different one, and it makes it far easier for you as a carer in the future to clean your partner's teeth. And you should get a prescription for higher concentration of fluoride in toothpaste, and occasionally you may need a mouthwash. But there are other products available, such as this toothpaste, which has been developed in the UK and has been licensed in the States. It works by actually adhering to the tooth and also releasing some of the minerals that we lose in a dry mouth. And there are other products available elsewhere in the world that help stop decay in the mouth. And there are other innovations elsewhere. As we all know, we can have clear aligners, but the same technology for them can also help people in care homes. We could apply fluoride varnish at the home, or even better, some other solution that does more than just add fluoride, as in the toothpaste that you saw earlier. So the technology that we have in the dental surgery can now be taken to care homes, and this goes on in the States already. So why don't we do it more here? Well, it's going to be cost. In a few years' time, these scanners will be able to diagnose the caries, and we can use our mobile phones. Probably not so much like this, as the best video I could find, but like this, using your mobile phone to scan the denture before you use it, so that we can print it when that event happens. We will be able to send files to dental labs to get dentures made within 24 hours. And these cheap cameras will be useful in sending photos to your dentist. The problems of poor oral health were highlighted during COVID, when elderly people were more likely to die because of their poor gum health. But we can still apply these three aspects. We spent 36 billion on track and trace, yet no one's done the follow-up research to see how many of these people come back to have their teeth taken out. So now, both these age groups are familiar with mobile phones and videos on them, so we should utilize them. And hopefully you've downloaded the app and this is where you're looking at the video at the moment. But if not, go to the website careforteeth.org, where there's further advice. And we now know improved oral health is directly related to your general health. The best support for those living with dementia is probably similar to those in fellowships such as AA, so join a group like this. And clearly I've got an interest, and this is why, so I've made this for you, Dad. I know you would have wanted people to have benefited from your experience.